So I'll be just talking about the new technique which is called as a terminal chop. This is the technique to achieve full thickness nuclear segmentation in hard mature cataract. We all have been coming across the hard cataract, which are really all nucleus with very little epinuclear and the cortical buffering material behind. So you have these nucleus which is fibrous, sclerosed and very hard and very thin and very weak posterior capsule. So you always have a risk of getting the posterior capsular disruption. But one thing which is very important with these hard cataract is these hard cataracts are identical to solid hard rock. They are stronger in compression, but they are weaker in tensile strength. What that means is, if you want to break, crush or sculpt, it's really difficult to do. But if you want to split, it's so simple, like you can split like any hard rock. So splitting force, because you have to find out the weakest point in the solid structure, so you can have a complete splitting rather than breaking it, crushing it or sculpting or doing a trenching in it. It's really difficult to do all these things. And the important thing is, if you want to split this hard rock structure, whether it's nucleus or the hard rock, you have to apply dispersive or lateral separation force. And these forces has to be applied at the point of natural weakness. You have to try to find out the natural weakness in these hard cataract. And the forces should go along the natural cleavage plane. So all these hard structures have some or other form of the natural cleavage, because if you look at these hard rock, also have natural cleavage plane. If you try to find out the natural weak point, you can very simply split these hard rock. Similarly, the same principle works here in the hard nucleus, where you already have a natural cleavage plane and the weak point. The weak point is the equator, and the natural cleavage plane is the cleavage plane along the nuclear fibers. And these are typical anatomical arrangement of these nuclear fibers, which are extending from the equator from one side to other side. And these nuclear fibers have a cleavage plane, and you can very simply split the cleavage plane between the nuclear fibers. So terminal chop works on the same principle, and this is basically about utilization of the unique mechanical forces to pull apart and split the hard nucleus from its weakest soft and thin equator through the natural cleavage plane along the anatomical arrangement of the lens fibers to achieve full thickness nuclear segmentation. So you can see here in this video, like we are keeping both the instruments at the equator. The phacotip is at the equator and the chopper is at the equator, and by lateral separation of these two instruments you can achieve a full thickness splitting of the nucleus, because that includes the posterior plate as well. Now look at this short animation. So this is how we can achieve the full thickness nuclear segmentation. You have to reach the equator. Your phacotip has to reach the equator here, and your chopper stays here, because it's unlike in Nagahara's job, where we are keeping the phacotip at the center and then bringing the chopper upon the periphery and incising the nucleus and coming to the center. So it becomes really difficult in these hard cataracts, because the hard cataract starts moving and your vector forces changes, and then you do not get the complete nuclear segmentation. The various techniques which we all have been practicing, the divide and conquer, stop and chop, all these techniques now, some or other how, like we have already left, we have shifted to the chopping technique. And because the reason is because in these cases you have to do a lot of sculpting of the nucleus to go very deep and very wide sculpting. You have to use a lot of energy, a lot of manipulation to fracture the nucleus, and many times you get into the problem of the posterior capsular disruption, or quite some time you do not get the complete division also. Because if you do not get the division of the nucleus, then you know the problems you come across during the investigation of these hard nuclei. Similarly, Nagahara's technique I was speaking about is also a technique where we use all the mechanical forces at the center of the nucleus. So this is the center of the nucleus, because your phacotip is going at the center and then chopper is coming to the center. So it's the mechanics is used here at the center, and the center of the nucleus is the hardest. It's bulky, very hard, very thick, and very difficult to segment and very difficult to chop the center of the nucleus. See this video of the classical Nagara's Figo chop, where you have to penetrate the nucleus very deep into the nuke at the center and then bring the chopper from the periphery. You have to basically incise the nucleus, cut the nucleus from periphery to, and it's really difficult to cut these very hard nucleus, and you end up with the incomplete nuclear segmentation, and then you have with these incomplete nuclear segmentation and the conjoined segments, like the joint segments, then you really find problem in getting them to the phaco tip and emulsify them, which needs a lot of manipulation. You have to rotate the nucleus all around and keep going into the nucleus and try to get the pieces to emulsify them, and it's really difficult. So these problems, actually, because of these problems, the Nagara job underwent many modifications, but still with hundreds of these modifications also, we are at the same point. Like we still have to use the mechanics at the center of the nucleus, and we do not get the complete emulsification, complete segmentation of the nucleus, and then find problem in emulsification. In terminal chop, what we are doing is we are taking both the tips to the periphery and using a dispersive force. You see the dispersive force, which is going lateral separation, because look at the chopper, the movement of the chopper. The chopper stays here only at the periphery because it's not going towards the phaco tip. You just have to split the nucleus, and you'll see this very well in this animation. A very hard cataract, and the most important thing in these hard cataract, and if you want to apply the terminal chop, is you have to achieve a good large rhexis. The rhexis is very important, and it has to be a little larger than 5.5 millimeter, not larger than 6 millimeters. And once you get the large rhexis, you have to make a very small trench at the center. Now this trench is very superficial. It's hardly 1 millimeter deep, 1 millimeter wide, and 2 millimeter in length from the center towards the equator. So see the depth of this trench. We are not going deep into the nucleus. And then engage the distal end of this trench with the phaco tip, and then look at the movement of the phaco tip. You have to reach the equator. You don't have to go down here towards the posterior plate, what we normally do in other chopping technique. And then see the position of the phaco tip is here. Slightly pull the nucleus and then hook the equator of the nucleus with this chopper. This chopper is a blunt chopper. It's just to hook and engage the nucleus, and look at the periphery of the nucleus, which is very soft. You have to engage and then see the movement of the chopper. It has to go a lateral separation, because the movement of the chopper has to go this way and the phaco tip this way. And how you get the complete separation of the nucleus. A very simple technique, very, very effective, and the most important part with this technique is, like any new beginners can also use this technique and very simply learn this technique. Very, very simple. Now the mechanics of this technique, the concept was taken from how we tear the fabric. So you know how we tear the fabric, because to tear the fabric we have to give a small nick at the edge. This is how we do normally at home. And then hold the two flaps of the fabric after giving the nick. Just hold it and then put a lateral force, lateral separation force. This is how you tear the fabric. So this is the same concept used here in tearing the nucleus, because we are not chopping, we are not cutting the nucleus, it's basically tearing the nucleus into two complete pieces. And this technique evolved with the continuous work and the experiments we did in our wet lab. The experiments were done on the hard nuclei which were extracted from the extracapsular cataract surgery we achieved. And look at the first video here. This is hard nucleus, and we are trying to do the Nagara's chop here. Penetrated at the center and trying to bring the chopper from the periphery to this. Now this is so hard nucleus, the chopper won't come to the center. Nagara's technique is very good, like it works very well in a modest kind of hard nucleus. If your nucleus is modest, where the chopper can move into the nucleus, then it works very well. But if the nucleus is very hard, then you don't get it. And you just get the pieces like this, because the phaco tip would engage with some pieces from the nucleus, but the chopper won't work. But look at the next video here. This is also a hard nucleus, but we didn't try the Nagara's job. Look at the movement of the FICO probe. We entered from the center and went to the periphery. Now the FICO probe is going towards the periphery here, and then the chopper has engaged the equator of the nucleus. Now both instruments are at the equator, and they are now going a lateral separation force. And with the lateral separation force, you can very simply segment the nucleus into two complete pieces. So simple. So here, one of the very hard cataract, and look at the movement of the FICO tip. Superficially, it's going towards the equator, and then the equator is hooked with the blunt chopper, and both the instruments are moved away from each other and creating a lateral separation force to segment the nucleus. Now, why we are going to the equator? If you look at the structure of the nucleus is very, very thick at the center here, but look at the equator of the nucleus is very thin and very soft. And this is primarily because of the arrangement of these nuclear fibers, which are extending from the anterior to posterior pole. And these fibers are very densely packed at the center than at the periphery. At the periphery, these fibers are very sparse, and you have very good space between the nuclear fibers to achieve the cleavage plane between the lens fibers. So basically, in the mechanics of the terminal chop is the principle, we utilize the principle of breaking a rock, that is, don't compress, split the hard object along the natural cleavage plane. The second principle is structural configuration of the lens with unique anatomical arrangement of the lens fabric is utilized in this concept of terminal chop. That is, identify the weakest natural point of the object. And third is mechanics of the tearing of fabric. That is what the mechanics we are using in terminal chop. And initiate the split with a small nick at the edge of the object, and then you can get the complete segmentation. I'll just omit this video and look at this video. A very hard and black cataract. But what you have to look at here is a small trench is made, and then see the movement of the FICO probe. Look at the movement of the FICO probe. You have to go superficial, you don't have to go deep. So that is the most important part in this technique, because you have to go superficial. Look at the movement of it's so superficial. You are going within the nucleus surface, and then hook the periphery with the chopper. And then after that, you see the movement of both the instruments, because both the instruments have to move away from each other. It's called as a lateral separation force, dispersive force. And see how you can get the segmentation of even the black cataract, hardness of hard cataract, which otherwise normally we wouldn't have thought of doing phacoemulsification in such a situation and convert to the ECC. But here with this technique, you can segment any kind of hard cataract into two complete segments. This is a small video. Look at the movement of the FICO probe has to go to the periphery, and then it has to be engaged here, and then both instruments have to go away from each other, the lateral separation, and you get the complete segmentation. So to conclude, the crux in terminal chop, the important points in the terminal chop is, the first important point is do not go deep, stay superficial. Your FICO probe has to stay superficial. You don't have to go deep into the nucleus to have a hold of the nucleus at the equator. The second important point is reach equator, don't stay at the center. So you don't have to stay, your FICO probe has to start from the center and it has to go to the equator. You don't have to stay at the center or go deep into the nucleus. The third important point is, do not incise. Your chopper should not incise the nucleus. Chopper should stay at the periphery, and it should be used for the lateral separation force to split the nucleus along the cleavage plane. So the best part of this technique is, because we always used to get afraid of this hard cataract going deep into the nucleus. Our FICO probe had to go deep into the nucleus to have the firm hold of the nucleus, and then chopper used to come from the periphery. So these two movements used to be very, very dangerous to the posterior capsule, because your FICO probe, you do not know like how deep you have to go. That people have devised caddick chop and all these things so that you don't go very deep into the nucleus. And but here in this technique, you don't have to go deep. You have to stay superficial. So there is no worry about the posterior capsule because your probe is superficial. And your chopper is blunt. You're not using sharp chopper. It's an olive tip chopper, blunt chopper, which you have to engage the periphery of the nucleus. You are not engaging the posterior capsule. And with the later separation course, it's so simple, like even the hardest of heart cataract you can very simply segment. Within a second or 2 seconds, you get the complete segmentation of the nucleus, and then you can very simply emulsify the nucleus. So one should try and use this technique, which is very, very good and would be very useful. Thank you. Thank you.